Hi everyone. Today we're going to be talking about neck pain, headaches, and upper part of the back pain and exactly what you can do from home. So if we haven't met yet, I'm Dr. Dan with Dr. Pascal here from Lindenwoods Chiropractic. So we've done a few videos and we've asked you if there's any questions, if there's any comments, if there's any videos that you would like us to do to help you while everyone's kind of quarantined at home. And one of the things that we've definitely heard a few times is how and what to deal with neck pain, extra pressure in the neck, especially in these stressful times, pressure in the upper part of the back, and headaches. So today we want to give you some simple things that you can do to help with that.
Okay, so what we're going to do is a lot of time spent in this forward bent position like that causes a lot of strain to the tissues, the muscles, the ligaments, and the bones in the neck and all the way up to the base of the skull. So the first thing that we want to do is stretch those tissues and get them moving. So we're going to show you guys some stretches for the neck. You can perform these standing, but we're going to show you guys seated. Okay, so the first thing Dr. Dan is going to do is tuck his chin down to his chest. Okay, now all of these stretches, you only need to hold them about 5, maybe at most 10 seconds per stretch. Okay, we'd rather you repeat them 3 to 4 times than hold it for a long time. So you get it to that end range, and you notice Dr. Dan's using his hand so he could pull into that stretch, get a little bit deeper of a stretch. It should feel like a stretch. It should not be painful. So a little bit of a deep stretch, slightly uncomfortable is fine, but not painful. Okay, then we want to hit the sides of the neck a little bit more. He looks down and then he rotates towards the shoulder. Same idea here. If you want to increase that stretch, you can reach the back of your skull with a hand and pull deeper into that stretch. Okay, so he started with chin down and then rotating the neck to look at a shoulder. You want to repeat this again 3 to 4 times, holding 5 to 10 seconds in that stretch. Then he's going to look straight ahead. He's going to imagine he's bringing his ear down to his shoulder, so just dropping his head to the side. Same principle, pull on the skull if you'd like to increase that stretch, and then he could do the same thing going the other way. Lastly, we could do a cervical rotation, so looking over a shoulder, pulling on the skull to get a little bit deeper in the stretch, and then same thing going the other way. Okay, so those are fantastic stretches that you can repeat. If they feel good, they're relieving pain, go through these as many times throughout the day as you'd like. Okay. Again, those tissues build up. We get a lot of pain in the shoulders. We get a lot of pain in the upper neck. We can do some self-myofascial release at home with a ball. So here we have a specific mobility ball, but if you have a tennis ball at home, a lacrosse ball, even a golf ball potentially could work. What we're doing there is we're trying to find some knots, those tender areas in the trap muscles, and you're finding those areas, you're putting pressure on there, and you notice Dr. Dan's using his shoulder, he's rolling his shoulders, moving around a little bit. The goal there is to break up some scar tissue and get those muscles to relax and release to take pressure off of the spine. Next component we're going to talk about, this is something called the dental roll. And if you're a patient, you almost guaranteed have a roll like this at home, not necessarily just a neck roll. It might be low back or it might be mid back for you, but a lot of people have neck problems, loss of curve in the neck, and so they have this specific device. This device has a ton of large scale research behind it, supporting its effectiveness in decreasing neck pain, improving bad posture, and decreasing pain with headaches. So guess what? If you're a patient and you're suffering from those things and it's worse right now, you have the tool at home to significantly improve your situation. Okay, so we're just going to give you guys a refresher on how to use this at home and how long to use it for. Okay, so the neck roll you do on the ground, or if it's the mid-back roll for you, you're doing this on the floor at home. You don't do it on a bed, that surface is too soft. You have a specific placement which we've shown you, whether that's the high neck, the mid neck, the low neck, between the shoulders. It all depends on where that loss of curve is or the problem is in your spine. You start with 3 minutes, and we're going to build in 1 to 2 minute increments until we get to 15 minutes a day, which is that magic number to help recreate the proper position of the ligaments in the neck. Okay, this shouldn't cause any significant pain. It might be a little bit of a dull ache while you're laying on there, but this should feel like it's relieving pressure from the spine. You don't sit up quickly when you're done this. You just pull the neck roll out, and then you rest on the ground for a minute or two before you pop up. Okay, so that's a quick refresher on using that dental roll at home. If you're not a patient and you want to know if you're a candidate for a dental roll, reach out to us, info@lindenwoodschiropractic.com, and then we can assess if you'd be a proper candidate to use one.
Yeah, so the other thing too is a few days ago we also did a video on posture. So especially bad posture will increase the pressure and stress in your shoulders, your neck, and headaches. So go back and see that video, and hopefully that could help you as well, especially with a proper setup in terms of ergonomics at home and what you could do to kind of help to stretch your spine spine back to feeling definitely a lot better. So hopefully that could help you. Again, if you have any questions, comments, leave a comment below or email us at info@lindenwoodschiropractic.com. Have a wonderful rest of your day, and we'll see you soon.